Sheriff Woody, for allowing me to do this morning, and thank you for everybody for attending. Organizations like Kingdom Life Ministries, or KLM as I'll refer to it, are in existence because of the wide-reaching ripples of substance abuse that affects every pocket of our society. Aside from the problems facing the addict, ramifications created by substance abuse stretch to family members, law enforcement officers, corrections officers, children exposed to substance abuse, and citizens victimized by criminal actions committed by users. The seemingly hopeless correlation between substance abuse and recidivism is what drew me to study KLM and their recovery program that follows a peer-based model. My research revealed that KLM is saving the Commonwealth almost $8 million, as well as lowering recidivism rates significantly. The results of my study clearly illustrate that the fight against substance abuse and recidivism is not hopeless. It's my hope that future policy will help implement and support more effective programming, as well as saving the Commonwealth tremendous amounts of money. KLM, as I mentioned, follows a peer-based model, which is recovering addicts and alcoholics, educating, mentoring, and spreading the message of recovery to folks that are new to sobriety. It began in 2008 and was founded by the McShin Foundation. John Shinholzer, who we've heard about before, is the president of that, and is currently run by Pastor Kenneth Barbour, who's also joining us today. It was founded in order to address the problems that I previously discussed. And as mentioned, it's a nonprofit organization that the sheriff lets come into his jail and work with his residents because he sees the importance of having a program such as this available to the individuals that he serves. The peer-based model is executed at 4 points of impact: the jail component, court component, reentry preparation component, and post-release component. Treatment across all 4 of these components includes the core elements of spiritual principles, AA, Alcoholics Anonymous, and AA, Narcotics Anonymous, training, and also behavioral modification. The jail component works in collaboration with a program called Men in Recovery, or MIR, led by Colonel Alonzo Pruitt and Mike Kelly over here. They both share the responsibility of the jail component and adhere to the core elements that I just discussed. Daily, the program directors and staff of KLM and MIR become a resident of the tier and provide small group meetings, works with NA and AA literature, spiritual principles and Bible study, behavioral modification, anger management, and many other sessions. Upon release, if they decide to stay a part of the program, they're provided with transportation, housing, clothes, food, access to employment, friends, and most importantly, a loving, caring recovery community. I examined the KLM program from its beginning in February of 2008 and concluded in September of 2011. And my main goal was to examine the effectiveness of the program in 2 stages, both while the men were incarcerated and also upon their release. I also examined the effectiveness of the KLM model, or of the peer-based model. It's widely used in other states and really is cutting edge and is very successful in other states, but it's rather unique and new to Virginia, so I wanted to figure out if it was working. In order to collect both the qualitative and quantitative data that Dr. Bosher referred to, I spent 1 day a week in the jail for 3.5 years. And it was during this time that the men would fill out surveys for me. I conducted hundreds of interviews and also observed sessions of what their daily program was like. I also attended their alumni meetings, which happened weekly, which was the men who had been released would attend these meetings each week. And looking at the quantitative analysis, just some basic demographic data, the mean age of the men on the tier was 34 years old, ranging from 18 to 64. 86% were African American, 2/3 had a high school education or some type of high school education, and about half of them were incarcerated for a nonviolent felony. The first hypothesis that I looked at was that if an inmate undergoes any type of treatment, then the recidivism rates for that cohort will be lower than those who don't go through any programs at all. And unfortunately, this hypothesis cannot be concluded on. due to the variances of recidivism rates. As it was alluded to earlier, the Richmond City Jail says that their recidivism rate is 44%. However, that's not fully accurate. The reason for that is because that 44% is only reflective of if the individual was reincarcerated in the city jail. So if they get arrested in any other locality, that's not reflected in the 44%. However, the first hypothesis is where I really looked at the control group, which is another program tier of the jail, and their recidivism rate was 52%. So while on paper it looks as if the control group rate is higher than the Richmond City Jail rate, we can't conclude upon that because of the discrepancies that I just discussed. The second hypothesis was that if an individual participates in KLM, their recidivism rate will be lower than if an individual goes through another program. This is confirmed. We know that the recidivism rate of KLM is 34%, and that is accurate. That includes if the men were reincarcerated anywhere throughout the Commonwealth of Virginia during my study period. So right there we know that KLM's recidivism rate is at least 10% lower than that of the jail and 18% lower than that of the control group. I also ran an analysis called a pair-T test. That allowed me to determine the average amount of time in between incarcerations before the program and then after the program. After the KLM program, the amount of time in between incarcerations increased by 6 months. So this revealed that it is an effective program because there is a statistically significant relationship. For the control group, the amount of time in between incarcerations actually only increased by 25 days. That proves to us that the program is not as effective and it actually works for less people than it does work for. Additionally, I was able to look at the correlations to recidivism to determine which variables are the highest predicting factors in recidivism. The first one is the number of times a person has been to jail, how long that they've been released from the program, and which crime that they committed that landed them to this incarceration. I believe all of you got my executive summary, and on page 7 of the executive summary, you'll see a chart that really illustrates these variables. But if an individual has been to jail once, their likelihood of recidivating is between 2 and 4%. If they go to jail 2 or more times, that percentage increases to 75%. Absolutely unbelievable. We then go and look at the cost savings. We all know it costs about $25,000 a year to incarcerate somebody in the Commonwealth of Virginia. However, through the increase of time between incarcerations of the men who go through the program, this saves $14,500 per inmate, equating to over $7 million of savings. Then we look at emergency room visits. This tier was the worst tier of the Richmond City Jail prior to this program. Hands down, worst tier of the Richmond City Jail. They had so many fights on this tier that led to emergency room visits, between 2 and 4 visits a week, each one costing about $2,000 each time. Since the program began, there has not been one fight or altercation that has led to an emergency room visit. This alone saved $840,000 to the state. So looking at this almost $8 million savings is unbelievable, especially when you consider this is to one tier of one jail in the Commonwealth of Virginia. Can you imagine if this program went to other tiers of this jail and all across Virginia? The savings would be unimaginable. I also conducted some secondary data analysis to look at other programs in Virginia and also throughout the United States. And it seems that the efforts in Virginia are just not keeping pace with other states. The majority of programs in Virginia actually lack the funding or the ability to conduct evaluations, so we're not really sure if they're actually even effective or not. Through the analysis, it also is evident that the state programs are much more expensive and much less effective as well. I looked at over 50 programs in Virginia, and it seems that 2, right here in Richmond, are among the most effective and cutting-edge programs in the Commonwealth. This is the McShin Foundation, run, as I mentioned, by John Shinholzer, and the Healing Place, and we have Kara Kaufman, I saw her come in right there, who is representing the Healing Place today. I won't go into too much more detail excuse me, about the secondary data analysis, but in the executive summary, there is ample information about this part of my study. The most exciting part of this research for me was that I was able to develop a best practice evidence-based model from not only my research that I conducted, but also by looking at hundreds of other studies that involved Virginia and the nation. While I understand that programs are targeted at serving their population and their demographics, it is these factors that I'm about to discuss that should be present in all programs. First of all, it needs to be a peer-based model. Somebody in recovery with been there, done that mentality. Who better to tell an addict how to go through withdrawals after 30 years of heroin use than somebody who has been in their shoes before? It needs to be available upon confinement and also after their release. Having both is absolutely key. And while it should be available for everybody, it really needs to focus on offenders during their first confinement. A needs assessment needs to be developed upon confinement to figure out where these individuals are in their life and what they need to begin guiding them in the right direction. The structure of the program needs to be rigorous on the tier so that they don't have time to sit around, learn how to become better criminals, and meet more drug contacts for the street. 6 months prior to release, a transition plan needs to be developed so these individuals can figure out how they're going to be successful in life and be law-abiding citizens once they are released. Once they're released, they need the program to pick them up from jail. Most of them are given $25 in a bus ticket, certainly barely enough to get by, so they need to be met with a ride and be provided housing. Most of these individuals who are incarcerated have burnt so many bridges that the only people that will welcome them back are the same people on the same street corner doing the same things that they were doing prior to their release or prior to their incarceration. Certainly that's not where they should be going back to, so providing them with housing is absolutely key, as well as helping them get important documents such as an identification card, a birth certificate, helping them develop a payment plan for debt, helping them get health care, Medicaid, food stamps, everything that they need to begin in the right direction. While there are some programs in Virginia that follow these steps, there really aren't many, if any at all, that follow all of them. The McShin Foundation, the Healing Place, and Kingdom Life Ministries are among the only ones in the state that encompass almost all of these factors. And it is these programs that should be looked at with a fine-tooth comb as a model to how other programs should act and how they should carry out their daily activities. In conclusion, lawmakers and policymakers should act on research and evidence-based measures and not slogans such as getting tough on crime. While it sounds great for re-election, it certainly is not the smart thing to do, nor is it the most effective way to do things. Committees, groups, and analysis should occur to determine what Virginia is and is not doing. This needs to include experts in the field who are delivering services, people who've battled substance abuse, and maybe even folks who've been incarcerated. They are the ones that can best say how to rehabilitate somebody who they were in their situation previously. While I certainly admire the efforts of the many people in our community who are doing great work and saving lives every day, I would love to see programs evolve and be enhanced in a manner that is proven to be effective through research. Thank you.